Welcome back to Squawk Box, everybody. Hospitalizations of children with COVID in the U.S. has hit a record high over the weekend. More than 1,900 kids. Former FDA Commissioner Scott Gottlieb is saying that health officials, they aren't even collecting nearly enough data on cases in young age groups, and he says that needs to change. He's with us now. He's also a CNBC contributor, and he serves on the boards of Pfizer and Illumina. His new book, Uncontrolled Spread, Why COVID-19 Crushed Us and How We Can Defeat the Next Pandemic, is coming out in September. Dr. Gottlieb, thanks for your time. Let's start with this issue with kids in particular. So 1,900 isn't a huge number. It's still awful, but you're saying it could be way underreported?
Well, the amount of infection could be way underreported. We don't know how many kids are actually getting infected. All we know is how many kids are getting diagnosed. 1,900 is a lot of hospitalizations. There's about 27,000 pediatric hospital beds in the United States. About 5,400 of those are pediatric intensive care unit beds. And about 1% of kids who get diagnosed with COVID get hospitalized. About a third of them get admitted to the intensive care unit. So we don't have a lot of pediatric beds in this country. We could find ourselves in a situation where we start to get pressed for capacity very quickly, especially if a lot of kids remain vulnerable and we end up going back to school and you start seeing outbreaks in the school setting. Right. The reality right now is we don't know how many kids have been infected.
So let me ask you about the vaccinations. There are parents who want their kids vaccinated for protection because 1% resulting in hospitalization sounds way too high to a lot of parents. What is the advice on vaccinations at this point, if they're still waiting?
Well, look, about 8 million kids have been vaccinated right now. So a lot of kids 12 and above are eligible to be vaccinated who haven't been vaccinated. So I would urge parents to consider vaccinating their kids. And it's not a binary choice around vaccination. It's not a choice of whether I vaccinate or I don't vaccinate. There's different approaches that parents can take. If you have a child who's more vulnerable, you might give them the full 2 series. If you have a child where you might have some concerns about vaccination, you might give them 1 dose now and wait a little bit. So I think every parent should talk to their pediatrician about the right approach to vaccinating a child. Not just view this as a binary decision, but view it as a decision where there is some discretion that you can take in terms of how you approach vaccination in a child. For 12 and under, the vaccines are going to take a little longer. They're probably not going to be available till midwinter or late winter. Pfizer, the company I'm on the board of, is working on a vaccine for a pediatric population age 5 to 11. That's a 10 microgram vaccine versus the 30 microgram vaccine being used in older kids and adults. So we still need to get more children vaccinated. There's about 50 million children who are school-age children. Only about 8 million of them have been vaccinated. Many more are eligible. So there's still a lot of kids who can be vaccinated going back to school to try to provide a safer environment in the schools.
Hey, Scott, you just said mid to late winter. I mean, that's February you're talking about before this guy. I thought Pfizer was going to turn in its data for kids ages 5 to 12 by September. Why would it take that long to authorize on an emergency use basis for kids that age, especially high-risk kids that age, if you know that this Delta variant is more dangerous and putting 1% of kids or maybe higher levels in the hospital at this point?
Well, FDA has extended the scope of the trials that it wants in the pediatric population. So it's asked for more data, more children to be enrolled in those trials, and it wants longer-term follow-up on the kids in those trials. And so that's pushed out the timeline when that authorization could happen. Now, my belief is that if we start seeing a bad situation with respect to children as they go back to school, the FDA will be in a position to make an earlier authorization. So there will be interim points when they can look at that data and make an authorization earlier if they feel they have to. They have to make a vaccine available sooner. Hopefully things go well. We don't continue to see the same rate of death and disease in children that we're seeing right now. And FDA is in a position to make an authorization on the timetable that they've sketched out. But I think that they'll have some flexibility around that if, in fact, we start getting into trouble.